Hello students, welcome to Global Academy of Medical Education. I am Dr. Kabita and I'll take you through microbiology. Let us begin by discussing staining methods in microbiology. So what are the different staining methods? We have number 1, simple staining method. Number 2, we have negative staining. Third we have is impregnation method. Fourth we have is differential staining. In simple staining, we use only one primary basic stain, that may be methyl violet or methylene blue. It provides contrast, but since there is only one stain, all the cells take up that stain and there is no differentiation between two different kinds of cell. In negative staining, the most common example is India ink staining, which we use for the detection of capsule of bacteria and fungus like Cryptococcus, in which we stain the background, and that gives us a clear halo or contrast of the capsule of the bacteria. In impregnation methods, due to very thin cell wall, certain bacteria like spirochetes, we impregnate with some silver salts that give us the distinction, and we observe it under special kind of microscopy. In differential staining, the most important examples of differential stains are Gram stain, Zeden stain or Ziehl-Neelsen stain, and Albert stain. Now we are first going to discuss about gram staining. So gram staining was discovered by Hans Christian Gram in 1884, and that helped us in dividing the bacteria into two major groups, gram positive, which retain the primary color, which is violet, and gram negative, which do not retain the primary color and take up the counter stain, which is gram negative. So gram positive and gram negative. So how do we stain it? We use four steps in gram staining. The first step is primary stain, which is any of the para-rosaniline dyes like crystal violet, methyl violet, gentian violet, and after keeping for a period of 1 minute, we will wash it with tap water, and then we are going to add the mordant, which is grams iodine. So we keep the grams iodine mordant for a period of 1 minute, and then we add the, after washing with tap water, we add the decolorizer. Decolorizer is acetone or acetone alcohol. So if we are using the decolorizer as acetone, we keep it for a period of 2 to 3 seconds, and if we are using acetone alcohol mixture, we are going to keep it for a period of 20 to 30 seconds. After washing, after adding the decolorizer and washing it, we are going to apply the counter stain, which is safranin, which will give, or we can use even carbol-fuscin, and we will keep it for a period of 30 seconds. So after that, what we interpret it as, those who take up the primary stain, they are known as the gram positive. And those who take up the negative stain or the counter stain, they are known as gram negative. Now this is a image, this is a picture where we see gram positive cocci, which has taken up the primary stain and appear violet in color, known as gram positive cocci in clusters. And in the right hand side, the B image is that of gram negative bacilli, which take up the counter stain, known as showing pink in color, arranged haphazardly. So there are examples of gram positive and gram negative organisms. In gram positive, we have, in the shape of cocci, we are going to have if it is in the shape, in the arrangement of clusters, we have Staphylococcus aureus. If we have in the chains, it may be Streptococci. If it is in Diplococci or arranged in pairs, it may be Pneumococci.